Hello everyone, and welcome to the treatment group video for depressive and bipolar disorders. I will be focusing on the diagnostic category of cyclothymic disorder. My client's name is Jason Halston, and he is 37 years old. So, I'm sorry, I was a little disorganized. So the differential diagnosis is only cyclothymic disorder. This was ruled in because he met all the primary diagnostic features and his symptoms did not fit any of the other disorders or episodes for any of the other diagnostic categories. The primary diagnostic features are cycling between depressive and hypomanic symptoms occur with this disorder but lack the severity of a major depressive and hypomanic episode. Let's move on to Jason's story. Jason is 37 years old and works as a computer salesman. He is seeking treatment because his wife is insisting that he does, or she's going to file a divorce if he doesn't figure out what's going on with him. And Jason doesn't want to lose her, but he knows that there's nothing wrong with him and this is a waste of time. He has good days and bad days, but dismisses this because he thinks everyone else also has bad days and good days. When he describes them, he said that the bad days are last about 12 to 16 hours, and he lacks the energy, confidence, and motivation that he usually has, and he feels like a zombie on those days. He barely drags himself from the recliner or TV on those days. When asked how long he's been having these bad days, he indicates he has been having them as long as he can remember, and it doesn't last more than 3 to 5 days, and then the good days return. According to Jason, during the typical good days, he feels very confident and sociable, and he says that he feels good and fantastic thoughts just come to him. And when asked what his wife takes issue with, he says that when he's having good days, he will drink a little too much and use marijuana, and then he'll cheat on her, and his wife has caught him cheating a few times before. He admits that he actively sought to keep his promiscuity from her, but rationalized his secretiveness by stating that women just can't keep their hands off of him because he's irresistible. He says that I really am a powerhouse of a man. It's my duty to share myself with as many women who desire me. And he says that his wife doesn't understand that. And he says that alcohol and marijuana help him sleep when he's in good day periods. The good days would last anywhere from 1 week to a month, but they end abruptly, and when they would end abruptly, where he would just go to bed and then wake up and a bad day would be back. In school, his grades weren't the best. When he had good days and his mood was up, he would do well, but when he was down, he would do bad. This led to his teachers and parents believing that Jason was a bright kid, but he lacked the motivation. This has transferred into his computer sales job because his bad days lead him to call him sick, and then his performance is also not at its best. On a good day, he has confidence and charm and seems to have a good mindset, and he leads to a stellar sales level. Although he's considered a charming man in many social circles, he alienates friends when he is hostile and irritable, and he typically accumulates social obligations during the bad days and takes care of them on the first good day that he has. So that's it for Jason's story. Let's move on to the multi-axial diagnosis. Axis 1, cyclothymic disorder. Axis 2 is none. Axis 3 is none. Axis 4, his relationship is in jeopardy and he has work difficulties. In Axis 5, the GAF is 60. Lastly, we have the theoretical perspectives. There is only one perspective that pertains to cyclothymic disorder, and this is the biological perspective. So the client, Jason, may have a genetic predisposition for this disorder, and it has been found that bipolar disorder is also linked to cyclothymic disorder. Low levels of serotonin and norepinephrine leads to the depressive symptoms of the disorder, while too much norepinephrine leads to the hypomanic symptoms that he has. So that is all for my client. Thank you for watching.